Welcome to the Technology, Risk and Gambling podcast, produced by the Technology Addiction team at the Brain and Mind Centre at the University of Sydney. I'm Sally Gainsbury, Professor of Psychology. This season is entitled Informed Decisions, Financial Behaviour in Persuasive Digital Environments. And across these conversations, we've been asking what it actually takes for people to form intentions and follow through on them when the digital environments we're navigating are intended to influence behaviour. This season is supported by BetWell, a tool developed by our team at the Brain and Mind Centre, which enables people to bet with more insight, intention and clarity. BetWell is an example of the type of intervention I'm talking about this season, one that is intended to close the gap between what people intend to do and what they actually do. You can find out more at betwell.org.au. Most of this season, we've been talking about commercial digital environments, platforms that are designed to influence financial behaviour. But today I want to pull back and ask a bigger question around who's actually responsible for making some of the tools and ensuring that they're safe, trustworthy and genuinely useful. And what does governance look like across the whole landscape, including tools that are supposed to help people, not just sell to them? My guest today works at the intersection of policy, innovation and digital mental health at a national level. And I think this conversation is going to really reframe some assumptions that the field has been carrying. Hit subscribe, follow wherever you're listening, and I'd love a comment or a 5-star rating. Let's get into it. So, Maureen Abbott is Director of Innovation at the Mental Health Commission of Canada, where she leads work on e-mental health policy, national app assessment frameworks, and AI guidance for mental health and substance use healthcare. Maureen has built a national and international networks in this space, chairs the Mental Health Commission of Canada's e-mental health collaborative, and has spent years trying to answer a very hard question, which is how do you make digital health tools that are not just innovative, but are genuinely safe, equitable and worthy of trust. And Maureen and I have had the pleasure of meeting in person in Canada, in Australia, and every time we chat, I come away thinking differently. So it's so great to have you on the Technology, Risk and Gambling podcast. Thank you so much, Maureen.
Thank you for having me, Sally. And it's only been about a little over a month since I was in your office right there in Australia. So I'm so pleased to be able to be back virtually and be able to have this chat with you.
So, Maureen, there's so many things that we're going to get into today, so I'm really excited and thank you for coming on. But I want to start with the number that you presented recently that really just stopped me in my tracks, which is that 14% of Canadians trust AI tools to provide safe mental health support, which is a really striking number. What does it tell you about this? Should it be higher? Should it be lower? Is there a communication problem? Is this accurate? Is there a design problem? Is the field not just earning this trust yet?
Yeah, so this number of 14% comes from our new polling report that we just released in June. It was actually the day after I was at the University of Sydney, and it was launched at the International Mental Health Conference on the Gold Coast. And the polling is a collaboration with the Mental Health Commission of Canada and Mental Health Research Canada. And before I get to that 14%, I think it's really important to note that in that poll, 76% of Canadians found AI effective for managing their mental health. So AI can really improve access to mental health information and offer really personalized support. So, people are finding it effective, but as you mentioned with that 14%, they don't trust it, but they're still using it anyway, which is so interesting. So these findings to me suggest that Canadians are not resisting innovation, but they're asking for AI that is safe, that is transparent, that is accountable. And think about it like online banking. I don't know about you, but it took me a long time to be able to trust that. But now most Canadians, and I think people around the world, do trust digital banking because of the strong safeguards, consumer protections, regulations. So these have really been built over time. And I think AI for mental health will follow a similar path because public confidence is going to grow when people know that there are good protections in place. And there's been a lot of mishaps with AI and mental health in the media, especially. But our work at the Commission, and we talk to a lot of folks, both within Canada and internationally, and with our work like the National AI polling, our app assessment framework, and the development of national guidance for AI for mental health and substance use health, we heard consistently that trust must be earned. And we've met with people that have told us it's really important to have transparency, evidence, explainability, human oversight. And this suggests that the challenge that you name is not simply one of communication. But people are really looking for evidence that AI has been designed responsibly and also supported by these safeguards. So people are not asking us to slow innovation. They are asking us to earn their trust.
Yeah, and I just think it's so amazing that the Mental Health Commissioner of Canada is so advanced in taking on this issue. Often there is this sort of policy lag where technology and what users and people are doing happens, and many, many years later, policy catches up or they start thinking about it. But you're way ahead of this. There's already all this work done, and the national framework has been launched recently for assessing mental health apps, specifically including AI. So mental health apps are not new, but this AI component obviously is quite new. And it has 7 different domains. So I really want to get into these because I think it's a really good way for everyone to start thinking about whether you're using them or designing them or recommending them as a health practitioner. So can you walk us through the app assessment framework that's been developed, what it covers, what it's trying to do, and why these different domains have been selected? I know there's a lot here, and we will link to all the details in our show notes. But I'd love to hear a little bit about it.
Absolutely, Sally. So there are up to about 20,000 mental health apps available worldwide, but only about 2 to 15% of these apps have any credible evidence behind them. So it's actually scary to think about that. So the Commission developed a mental health app assessment framework, and to do this, we worked with about 200 collaborators across Canada and the world, and we also collaborated with ORCA, which is the Organization for the Review of Care and Health Apps, to develop a framework that was really relevant for the Canadian population. And the framework assesses areas such as clinical evidence, privacy, security and usability, accessibility, and cultural safety. And from what I understand, the cultural safety section is unique to Canada, but also New Zealand. So New Zealand has a Maori population, and they also incorporated it into their app assessment framework. So this section on cultural safety that we built, it includes content on gender equity, accessibility, lived experience engagement, and Indigenous data security and privacy, because there is a long history of misuse in Canada of Indigenous data. We then took the framework and we turned it into a quality improvement process and an online review engine. So this is where apps developers can submit their app for review and work through the process of meeting the criteria in the framework. And we also collaborated with a province in Canada, Newfoundland and Labrador, to develop their own app library for their residents, with apps that have been assessed on our framework and others that met a baseline review. And this is a way for them to know which apps are safe for their region and share this with their residents. So you can think about app assessment sort of like a car. Whenever I get in my car, I don't think to inspect the engineering before I get in. And by the way, whenever I was in Australia, I was constantly trying to get into the wrong side of the car because everything is reversed with Canada where we drive on the other side of the road, and we had the steering wheel on the other side as well. But the point is, with vehicles, we rely on independent safety standards to give us confidence. And mental health apps should be no different. Independent assessment really helps people make informed choices without needing expertise in certain areas. So people shouldn't need to be cybersecurity experts or privacy lawyers, clinical researchers, for example, before they choose a mental health app.
And then it's so practical because a number of mental health apps out there are staggering, and some are created through research and evidence and partnerships with really credible organizations. Many are commercial or independent, which can mean anything from a single person creating them to a company. But there's really very little way for an individual to tell them apart, because especially with AI now, everyone can make a website that looks really good. So what are the ways that people, users or professionals, can determine which apps are reputable, meet the standards? What are the signals and signs that people should be looking for?
Popularity is not the same as quality. And research shows that user ratings and download numbers in an app store are not good measures of an app's quality. So think about restaurants for a moment. Restaurant reviews tell us whether people enjoyed the meal, but they don't tell us if the kitchen passed its health inspection. So choosing a mental health app requires the same sort of distinction. User experience certainly does matter, but so does safety and privacy and evidence as well. So we know there are some great apps out there for mental health, and we want to celebrate those. But we also know that there are apps that are advertising the wrong crisis line number and apps that are selling people's information for marketing purposes. And I want to be transparent that a lot of the characteristics that make a mental health app trustworthy are not really visible to the user. So this is where an independent assessment really helps bridge that gap. But there are a few items you can look for at the consumer level. So these include thinking about security and privacy. So read the privacy policy to confirm how your personal health data is collected and stored and protected. Also check if the app states its audience, so its intended audience, and whether it's appropriate for your specific situation. And then also look for transparency. So it's okay if an app does have a cost, but are they transparent in telling that to you? So look for clear information regarding the subscription fees and in-app purchases or free tiers that they might have. And you can also review apps that meet national standards in Canada through the Commission's list of assessed apps and also through the Newfoundland and Labrador app library. Just remember that an app store is kind of similar to a bookstore. So being available on the shelf doesn't tell you whether the information inside is really accurate or valuable.
And I want to bring it back. So our listeners of the Technology Risk and Gambling podcast and this season is about enhancing people's ability to make sound decisions and informed decisions online, whether it's about their financial well-being, and that obviously includes engaging with gambling sites. So it's great that we're talking about these mental health apps, because we know that a lot of listeners are people who work with health practitioners or are health practitioners. But I'm also thinking about the broader digital environment. So people who are offering gambling sites, financial platforms, and apps that are marketed to help people manage their behavior in multiple different aspects. So I appreciate, obviously, your remit is in mental health, but have you had any conversations or looked at broader range of sites that people are interacting with, whether these sorts of frameworks should be applied when people are making decisions and about their finances, about online spend, sharing personal information in other contexts?
So the Commission's framework was developed for mental health, but many of its principles like transparency, privacy, evidence, accountability, accessibility, these are all applicable across any digital environment where people are making important decisions or also sharing sensitive information. But we also found through our work on the national guidance for AI in mental health and substance use health that a one-size-fits-all approach likely won't support good innovation. So we need to think more about the intended use of the technology and the level of risks. So not all applications work the same or carry the same type of risk. So step one would really be determining if the risks and the challenges are similar or not between the apps, the platforms, or whatnot. And if there are similarities, there could be some value in considering how some of the criteria would work in another environment. So remember, it really depends on the risks and the challenges. And the greater the impact, the greater need for safeguards and oversight.
It's a really interesting question, and one that we keep coming back to this season around how to design platforms that are, whether they're designed to be neutral, whether designed to, motivate commercial interests or consumer best outcome. So I think that it's really useful for people to be able to access these frameworks and think about the principles of them, as you say, and around how do we design platforms or websites, whether they're commercial or not, that do how they influence people and think about what the outcomes of it are. And this then brings up the question of different types of people. And obviously dealing with mental health, they're a very vulnerable population because mental health, multiple mental health disorders do impact decision-making ability through different mechanisms. And then other vulnerable populations, obviously, including young people. And I was really interested when you were here and you were talking about Canada's recently introduced legislation, which is Bill 634, for anyone who's looking at the technical details. But essentially, this is around one of the implications of this, it would ban under 16s from accessing AI chatbots. Now, I don't want to get into the politics of it, but it does raise this question I keep coming back to, which is around the precautionary principle at work in digital health apps, which says that a tool has to be proven safe before it's allowed. And that's quite the reverse of many other consumer products, which essentially it's fine as long as it's, if it starts causing problems, then we look at things. But can you talk us through how this balance against the reality of people often accessing tools as soon as they're available, people not having access to any support in many jurisdictions? And I'm not, Canada's actually very good at providing mental health support, but there are many jurisdictions where mental health support isn't available, including for young people. What's the balance between providing tools that may be helpful if they haven't been tested?
Yeah, so social media and young people is a topic that both you and I have a lot of conversations on. And even while we were at the International Mental Health Conference, it was a topic we were discussing on the break. But for many communities, the choice is not between AI and traditional care. It may be between AI supported resources or no support at all. So that is why the goal, it's not to eliminate risk entirely, because that's never going to happen, but it's to reduce harm. So have you ever had the chance to go to a mountain town where there are roadways on the side of steep cliffs? Like there's some beautiful areas in Italy. I don't know if you've ever had the chance to visit, but I had the chance a few years ago to visit some of these areas. And there are usually guardrails along the side of the mountain to reduce harm. So the guardrails, they don't stop people from driving, but they're there to be able to support and reduce harm. And they allow people to travel with greater confidence because it reduces the consequences of mistake. Good AI governance also works in the same way. So good guardrails create conditions for innovation to be able to move forward safely. And the Safe Social Media Act, it really emphasizes a proactive approach to digital safety, like many countries around the world are taking. And Australia was the first. So Australia is really leading the force in these guidelines. But the Act is really trying to encourage companies to improve the safety of their products for youth. So it's not saying the ban will be there forever. It's more trying to get companies to be able to improve their safety so it would be safe. And in a digital world, there are young people that are navigating a really complex environment online where there are a range of online tools that can both support and impact their mental health. And we have a resource coming out with the Commission and the Knowledge Institute for Children and Youth at the end of August on this, because there is some good happening with supportive online environments and peer support. So there's increased access that we see to mental health care. There's reduced stigma. There's tailored support and social connection. And I think it's really important to emphasize the good that's also happening. And we hear that from youth and people with lived experience all the time, that, they are finding great connections online and great access. But at the same time, many digital media applications use attention-driven features that can negatively impact mental health. So as a young person, young people might find it difficult to recognize when a digital media is supportive or harmful due to this dual nature. So we're seeing internationally that restrictions can have some short-term benefits, but also raise challenges related to enforcement and equity as well. And the early evidence that we're tracking suggests a more balanced approach And it's needed to really pair restrictions with digital literacy education, mental health supports, and youth empowerment. So remember that good innovation balances safety while also improving access to support.
Yeah, I do really like that balanced approach. You're not requiring the individual to do all the work, that they're the ones that have to kind of navigate a wild west of everything out there, but you're really working
That's
on
right.
trying to make the platform safer and potentially providing cues for the user. It still does require the individual to pick the right sites and be mindful of what's going on. And there is this balance between the user's responsibility, but really a strong onus on the platform designers, which I think is very commendable. I
Yes.
want to get your advice since you're here. I'm going to
Yes.
shamelessly use you to pick your brains on something that I've been thinking about. And I've been working on ideas around encouraging sustainable gambling, recognizing that for many people, they are able to gamble as a recreation, as an entertainment, but we do want to prevent people from gambling at levels that are harmful to them. So prevention isn't just around identifying people who have gambling problems, but really working with people who are gambling in the first place. So I've been thinking about this idea of developing we know education is not overly interesting. People aren't really engaging in it. So if we can make it more interactive using something like an AI chatbot to take what would previously have been static education and allowing people to ask questions, get answers in their own context, go back and forth, really engage with educational information, particularly around things like financial literacy or how to engage in gambling safely, making good decisions online. So I'm thinking to myself, what do I need to put in place if I'm going to design an AI chatbot to help people to make decisions that are in their best interest, being mindful of how gambling products work, being mindful of financial literacy, of digital safeguards. But if it's going to be via something like a chatbot, which is going to be of more interest to younger people, what are the kind of safeguards? What are the steps I need to follow as a potential developer before I feel confident putting something out there?
So we know in Canada about 1 in 3 young people do engage in online gambling. So this is an issue. And I think whenever you were here in Canada at the commission, when you visited, it really enlightened me about the issue that's happening in Australia with online gambling. And we recently had our first AI chatbot go through our app assessment framework and pass. So the app is Mira, and it took a lot longer actually to go through the framework because there was a lot more to assess since I talk about risk, and the risk was greater than other types of apps. So, our work that we're seeing on AI guidance really emphasizes that transparency, human oversight, cultural safety, privacy, equity, and meaningful engagement with people with lived and living experience all contribute to building AI systems that are trustworthy and also fit for purpose. And we asked people in our polling that was just released, what improvement would be most important to you in order to make AI safer for mental health care? And can you guess what was number one? I think you might already know actually because you were at the International Mental Health Conference whenever I shared this, but your listeners might not know, so maybe they could take a guess. But it was human-centered care. So human involvement must really remain foundational. And it's really important that AI supports mental health rather than replacing that human connection. So technology may inform decisions, but compassion is one thing that remains uniquely human.
Oh, it's absolutely true that, robots can mimic. And we forget that because they can be convincing and authentic, but
Yes.
they're not the same, are they?
Exactly. Yes. It's really uniquely human to have that compassion. And you can build that into different processes, which is what we're really trying to showcase. But these safeguards like human compassion, human-centered care, these should really be considered before launching and then also revisited throughout the life cycle. So it's not enough to just do it once, but it has to be sustainable and continue it as systems evolve because trustworthy AI is built through good governance long before it's built through good code.
Yeah, I really like, and that was one of the things that impressed me most when we first met, was the focus on equity and inclusion. At the University of Sydney, we tend to use co-design and involve consumers, people with lived experience of gambling problems, people who gamble regularly, in all of the work that we do, because if that's our ultimate end target group, I think it's really important to have them involved all the way through. And that's really critical. And it's definitely one of the conversations coming out around AI is who are the developers and are they matching the population? So that makes sense. What is the balance between, people who are developing these things may have different sorts of resources available to them. Where's the focus on equity and inclusion? Does something have to work for everybody, because you might risk watering it down if it's too generalized as opposed to for a more specific population? What do you think is that tension between designing something that's available for everyone, potentially meaning it's actually ending up being relevant to no one?
Yeah. Well, Canada's diversity is one of its greatest strengths. And it's important to be able to build digital mental health that work for people with different languages, cultures, abilities, and lived experiences. And equity doesn't mean creating just one universal solution. So it means understanding who an app or an AI technology is intended to support and identifying barriers that might prevent people from benefiting, and also ensuring those perspectives are reflected through the design and implementation and the evaluation. So do you wear eyeglasses? Like me,
I
Sally?
do.
I don't think you
Yes.
do. Okay, I don't think I've
Yes.
ever seen you wear eyeglasses, so I wasn't sure. But glasses improve vision, but different people require different prescriptions. So if I put my husband's eyeglasses on, I can't see anything. There you go. But designing one pair of glasses for everyone would leave a lot of people with blurry vision. Digital mental health should follow the same type of principles. Equity is not about designing solutions that respond to different needs, rather than assuming one approach would work for everyone. So it's really important to be able to respond to those different needs of the populations. And we worked on our app assessment framework and the national guidance for AI in mental health and substance use health. And we heard a lot about the importance of engaging First Nations, Inuit, and Métis, equity deserving communities, clinicians, researchers, people with lived and living experience, to really ensure that these technologies are appropriate, that they're culturally safe, and that they're responsive to the communities that we're intending to serve. Equity isn't built by building one solution for everyone. It's about making sure that everyone has the opportunity to benefit.
Yeah, I really like this. And the balance between that you can start somewhere and then over time refine, test. Populations are going to
Yes.
differ. The more people use a tool, they're going to start using it in a different way. So really with what we're saying with these mental health tools, whether they're preventative or educative, you can't just set and forget. You can't launch something out there and just sit static. It's not a static website. It is something you have to keep going back to, which is why I actually am excited about my AI chatbot idea, because it does allow people to take the information and digest it in their own way and ask questions to adapt it to their own specific circumstances. Because we tend to find that, particularly around financial literacy, they're very, standard. So they sort of presume a level of net worth or particular goals, and that's not suitable for everyone. So if you don't have a very high income, you're not going to be saving goal. You're thinking about like a day-to-day living goal. They're very different ways of thinking about money. And the same with gambling. We can't just have a education that's presuming people have an existing problem or recognize that when they might not be thinking that at all, but they might want to be preventing problems. So I'd really like this idea of using AI to personalize the care and education, but obviously being an iterative process that we refine over time. Just before I move on to some rapid fire questions where you can share some resources, I want to just close that loop on the Canadian assessment framework. This process where people can apply to meet the framework. Can you tell me a little bit more just practically of where people can go? Is there a cost involved? How does that work if people want to have their mental health apps certified?
Yes, absolutely. So the commission does fund a certain number of apps every year that can be going through the assessment process. So it is a process. And that's the other thing that I think folks should be aware of, that it will probably take a couple of months of back and forth. So it's very much a quality improvement process. And this really speaks to our values at the commission that we're really looking to be able to improve mental health apps in Canada. And we've heard from developers that have been through the process that there is a really good return on investment for them whenever they go through the process. And they do receive a badge at the end showing that they've met the standards. And those that would like to apply can go on our MHCC website and find the app assessment framework application process. And you can either go through the process as an individual developer, and there is a cost because of more the back and forth with the quality improvement process for this, or every year we do fund a certain number of apps that can go through our app assessment process that way.
That's excellent. And we'll put those links in the show notes. So as we're closing out, Maureen, you've got such a huge degree of experience in these areas. Could you recommend what you're reading? If there was one book or report or resource that someone should learn more about this sort of area, what would that be?
Hmm. Well, digital mental health is really evolving quickly, and it makes and continuous learning for all of us really essential. So I think if anyone is looking to explore this topic further, I would recommend starting with the Commission's e-mental health strategy for Canada. And this really provides an overview of many of the topics that we discussed today, but also some of the resources we discuss in depth today. So this would include the app assessment framework, our national guidance for AI and mental health and substance use health, which is a collaboration with the Canadian Centre on Substance Use and Addiction. And also think about also the World Health Organization's ethics and governance of artificial intelligence for health, which is also a really good resource. So together, these really provide more practical guidance grounded in evidence and ethics and responsible implementation. But in Australia, there's incredible progress happening with digital innovation as well. So one area that I'm really inspired about is the e-mental health and practice that you have, which is an initiative funded through the government of Australia. And this is where there's free quality resources on digital mental health for practitioners. But my understanding is anyone can access the directory online, and it provides promotion and training and support on digital mental health to practitioners. It tracks uptake and referral and advises government on digital mental health policy. So remember to start with the trusted evidence first and then stay curious.
I really appreciate those practical resources. Is there anyone else you would recommend who's doing great work in this space that people should listen to or follow?
Well, this past June in Ottawa, we had a global leadership exchange e-mental health match. And this is where we brought together 27 global leaders in digital mental health around the table to discuss key topics in the area. And this was co-facilitated with the International Mental Health Collaborative. And one of the key quotes that we discussed in this meeting was, "Progress moves at the speed of trust." And this is a quote by Stephen Covey that really still applies to me in the digital mental health world. I've sort of become obsessed with this concept of trust with digital mental health. And I've started reading Stephen Covey because so many lessons in leadership and trust can also apply to digital mental health. And one of the things I appreciate most about working in this space is there's no single discipline that is all the answers. The more perspectives that we bring together, the better equipped we are to develop digital mental health that actually improves people's lives.
That's really useful. And I'm really curious with your expertise when you're looking at websites, whether they're mental health apps or tools or just websites and design in general. Is there something that you're seeing with your expertise that you think people designing tools, websites are really just getting wrong?
Well, we started out researching mental health app assessment frameworks by doing a literature review, and we were looking at kind of what are good app assessment frameworks or like digital app assessment or assessment in general. And we were shocked that very few people were engaging people with lived experience in their product. And I mean very few. Like you can count on less than one hand at that time. And this really baffled us because we know that engaging the user of a product really leads to better and more effective solutions. So we incorporated criteria into our app assessment framework, which really evaluates if an app incorporates the end user into a product. And we wanted to live this ourselves. So we also did, when we developed the app assessment framework, we had a person with lived experience who was also an app developer included right in our core development team. So think about building a bridge. It takes more than great engineering to build a bridge. It requires architects, it requires builders, inspectors, and also the communities that will eventually use it. So remember that good digital tools are no different. They're strongest whenever they're built collaboratively with others. And the best innovations actually begin by listening, even before building.
That's terrific. Look, Maureen, thank you so much for your time this evening for you in Canada. It's been a real pleasure being able to chat through these issues with you.
It's my pleasure, Sally. Thank you so much for having me.
That was Maureen Abbott. What I took from this conversation was the importance of thinking about the consumer experience, not just what their behavior is or what they think, but whether they trust the tools that they're using. And I think that's really an underrated feature of how people are, whether people are willing to experience and use a platform, but whether they really trust it. And how can we ensure that the platforms we're using are worthy of that trust? Maureen is asking this bigger question of what can we do to enhance the ability for people and for regulators to trust the tools, including the ones that are designed to help people follow through on their intentions. This is not just a problem for consumers, it's a design problem, it's a governance problem, and it's an equity problem, which is something that Maureen really established. And it's one of the few places I've seen these three aspects taken seriously at once. If today's episode's raised questions for you, I encourage you to look at the Mental Health Commissions of Canada work on app assessment and AI guidance. The links are all in the show notes. If you've been listening across the season, I'd encourage you to go back to our episode on Shanandi Gupta on deceptive design, because the question of what makes a digital environment trustworthy goes in both directions of what potentially makes it untrustworthy as well, and they're worth looking at together. You can find the Technology Risk and Gambling podcast on Spotify, Apple Podcasts, or wherever you listen. And of course, get the video on our YouTube channel at the Brain and Mind Centre. If this series is useful to you, I would love it if you could share it, leave a 5-star review, and hit that subscribe or follow button so we know that we're reaching people. This episode was recorded on the lands of the Gadigal people of the Eora Nation. I recognise and pay respects to the elders and communities past, present and emerging of this land, on the land on which you're listening. For thousands of years, they have shared and exchanged knowledge across innumerable generations for the benefit of us all. This podcast is produced by the Technology Addiction team at the Brain and Mind Centre at the University of Sydney, with production support from Eunice Wing and Asha Osborne. I'm Sally Gainsbury. Thanks for listening.